remains definitely to be seen how exactly these devices, if there is any device capable of doing this sound, were placed inside the American embassy in Cuba, which is obviously highly guarded. Anyway, moving on and moving to a tragedy in Yemen. In fact, Yemen hardly figures in any public discourse. Yet the humanitarian agency warned of 1 million cases of cholera by the end of the year, and of them around 600,000 will be children. Take a look.
Civil war devastated Yemen has been hit by a largely unseen attacker. Victims of a silent but lethal killer that has taken more than 2,000 people in the Arabian Peninsula's poorest country. In fact, epidemiologists say this is the fastest spreading epidemic of cholera in modern history. The NGO Save the Children said that half of cholera cases are of children below the age of 15. Clearly, childhood has no place in Yemen. The International Committee of the Red Cross labelled the situation as a catastrophe.
The situation from a humanitarian standpoint is a catastrophe. We have something which is close to 1 million cases of suspected cholera, maybe by the end of the year. But this, as I told you, is only possibly an external illustration of something more serious. We could have an outbreak of something else. Huh? I don't rule out that, considering the status of disrepair of some of these installations and so on, we could have something worse. So,
cholera did not come from the sky. Yemen is gripped by a deadly conflict which has killed nearly 10,000 people in 2 years. The country is cut in two. On one side, the Houthi rebels, a predominantly Shia militia, controls the capital Sana'a and the hills around. Iran is reportedly supporting them with funds and weapons. The rest of the country is loyal to former President Abdul Rabb Mansour Hadi, who is backed by a Saudi-led coalition that is blockading Yemen from the sea and from land. Saudi warplanes have been constantly bombing Houthi positions. The United Nations recently blacklisted the Saudi coalition for the killing of 683 children and the attack on schools and hospitals. The United Nations also condemned the Houthi rebel group for recruiting children to serve as fighters. The Yemeni civil war started as a fight between rival political groups. It has now become a new sectarian battleground between Iran and Saudi Arabia. Yemen's central bank is paralyzed. The nation's coffers are empty. Public sector workers, especially doctors, have not been paid in months. Al-Qaeda is reported to have taken advantage of the instability to establish itself there. Its local branch, called AQIP, is the target of a sustained US drone campaign. As war and sickness spreads, there's little time and even interest to look at the humanitarian tragedy unfolding. Bureau Report, WION.
And unfortunately, what is even very problematic about Yemen is the impossibility for the media, for whatever media houses, to reach the country. So Yemen, beside being already the poorest nation in the Arabian Peninsula and suffering a very hard civil war, also suffers isolation, media isolation. And I am joined on the phone line by Mr. Rajat Matok, who's the Chief of Communications and Advocacy for the UNICEF. Thank you very much for joining me on the broadcast. I appreciate your time. So you have, let's say, your hands on the situation, on the humanitarian situation in Yemen. What is the status of the art? How bad it is?
Thank you so much for having me. The conflict is reaching 1,000 days soon, and what's happened is that this has resulted in currently the world's worst humanitarian crisis. We've had a cholera outbreak, and we've had hospitals that haven't been functioning. We've had a complete system collapse in the past 2.5 years. On an average, we've reported in the past 5 months 4 to 5,000 people reporting sick with suspected cholera or acute watery diarrhea on a daily basis. And what sort of exacerbates the situation even more is the fact that over 50% of the health facilities or hospitals aren't functioning to the way they should across the country. There are nearly 90-odd districts out of 333 that don't have a single doctor available in these places. And to make matters worse, as you mentioned in your report, doctors, health workers, nurses haven't been paid for nearly a year.
And we understand that Yemen is under a sort of blockade. So how difficult is also to get the basic necessities there? I'm talking about medicals, I'm talking about medicines, if not equipment, in order to face and tackle these larger cholera outbreaks, sir.
I mean, just to give you a perspective, even before the conflict, nearly 90% of essential commodities were being imported into Yemen. Post-conflict, that's clearly stopped. So supplies are trickling in. The United Nations has launched possibly one of its biggest programs globally, and we are bringing in supplies into the country, but these are very few and far between. Medical supplies, basic medical supplies that are needed to counter or to treat people who've got suspected cholera, for example, such as oral rehydration salts, such as IV fluids, are in short supply. I was in a hospital in Sana'a the other day, and the doctor who was treating these suspected cholera patients didn't have gloves to wear. And you can imagine what it is to be treating patients for suspected cholera without any sort of protection yourself. So these are basic, essential medical supplies that are in short supply. We are we're flying in aircraft, we're using all possible sea routes to bring in supplies. But yes, it is a challenge.
Thank you very much. This was Mr. Rajat Madok joining us. He's the Chief of Communications and Advocacy for UNICEF, joining us from Yemen. Thank you very much, and thank you for the job you're doing for the people of Yemen.